The trays set up for SDF application include the following: a plastic protected tray, disposable DAP dish, petroleum jelly and Q-tips, super floss if doing interproximal application, a micro brush, 2x2s, cotton rolls, dry angles, bite block if necessary, and a plastic lined bib for the patient. Place 1 drop of SDF in the disposable DAP dish. 1 drop is enough for up to 5 applications. Generously apply petroleum jelly to the patient's lips, extending past the vermilion border to protect staining on the skin. Also place on any composite margins, crown margins, and white lesions, which are areas of previously arrested decay or demineralization to prevent staining. On our patient, we have placed petroleum jelly on the buccal of number 14 where there was a composite restoration. Isolate the affected teeth with cotton rolls and dry angles. Use the 2x2s to protect the tongue from staining if doing mandibular teeth. Remove any bulk saliva with the saliva ejector and then dry the tooth thoroughly with your air water syringe. It is extremely important for the affected teeth to remain dry for the best SDF absorption into the lesions. Bend the microbrush slightly to make access to the lesion easier. Dip the microbrush into the drop of SDF and remove any excess on the side of the DAP dish. Dab the microbrush onto the occlusal surface, making sure to immerse any cavitation with SDF. Don't forget to also run the microbrush along the grooves of the tooth to arrest any unseen decay as well. Let the SDF sit on the tooth for 1 minute. Remove any excess SDF from the surface of the tooth with a cotton roll, and then air dry the tooth. Remove the isolating materials from the patient's mouth, keeping in mind that they may have SDF on them. Place all disposable materials that have touched SDF into your gloves and invert one at a time to prevent unwanted staining. Place the gloves immediately in a plastic-lined garbage can. For teeth with interproximal caries, super floss is used. Insert between the contacts with the regular section and then thread through to the spongy floss. With the SDF soaked microbrush, dab the buccal or lingual side of the superfloss. Thread the soaked side through the contact and let the SDFs dispense into the interproximal lesion for 1 minute. After the minute, pull the floss through the contact and then blow air towards the interproximal lesion.